Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
I'm Michael Esquivel.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome back to the Heart of Healthcare podcast. I'm Hallie Tecco, and today my co-host Michael Esquivel and I will be chatting with a very awesome guest. But before we introduce her, we wanted to ask you a very quick favor. We know 7,000 of you are tuning into the show every month, and we are so grateful you come back Monday after Monday to listen. But we only have 100 some reviews on Apple and 30 some reviews on Spotify, which means that most of you have not left us a review. If you truly enjoy tuning in, could you please take just a second right now to leave us a 5-star review? Your feedback helps new listeners discover the show and lets us know what you think. Even if you just leave the stars, you don't have to actually write anything. If you want to write something, great, but you don't have to. It's super easy, and it really means the world to us and helps us grow the show. One more thing. You may have noticed that we removed ads from the beginning and the middle of the show. We are grateful to be able to do this thanks to sponsors like Veradigm who make this show possible. Okay, and now on to today's episode. Today, Michael and I are speaking with a close and longtime friend and colleague of both of ours, Christine Lemke. Christine is the co-founder and CEO of Evidation. Christine, thank you so much for joining us today.
I'm so excited to be here.
What happens at the doctor's office or hospital makes up a tiny fraction of our lives. Yet that tiny percentage informs the vast majority of healthcare recommendations and decision-making. Evidation was founded in 2012 on the belief that a direct connection with individuals and their everyday real-world health data can unlock a deeper understanding of health and disease and drive powerful discoveries across healthcare. Evidation now has millions of members in its community and has pioneered novel research and health programs across dozens of conditions. Christine, why don't we start with the backstory and what inspired you to start Evidation?
Everybody has their own health journey and health story, so I don't think you need a special one to work in healthcare. But mine in particular was I suffer from an autoimmune condition that causes a lot of chronic pain. And it took more than a decade to solve this problem, this puzzle of what it could be, how to treat it, how to name it, because sometimes I think it's important to name these things so that you can figure out how to manage them. And in my case, I suffered from sort of crippling chronic pain for probably most of my life, but more acutely for about a decade before I was finally diagnosed with an autoimmune condition in my late 20s. And so I thought, gosh, if we could measure some of these episodes more clearly and didn't have to depend on my memory to figure out when these episodes were, how often they were occurring, what severity they were. It just struck me that we could have maybe addressed this a lot sooner and solved the mystery a lot sooner too.
And Christine, we've known and supported your work for over a decade. So we know kind of how your journey has played out to date. But for our listeners, can you just talk about the evolution? What did you set out to do? And what are you doing today? And how did we get from there to here?
Because it was a direct line. As we know, you went from A to Z, just perfectly
Totally.
direct line. So
Perfectly. Yeah, perfectly. And I bet I have a narrative.
And because we have 3 hours today, so let's just get it.
I bet I have a narrative somewhere that says it's a straight line. But no, Hallie, as you recall, when I applied to Rock Health back in, I think it was late 2011 at this point, we pitched 2 different concepts because we had no idea what we really wanted to do at the end of the day. All we knew was we were experts in sensor data. We were obsessed with measuring health. We were trying to figure out what to apply that to. And so the first idea, if you recall, was actually measuring the onset of infections in hospitals. and being able to use sensor data to do that. Turns out to be just a terrible idea. It took us about a month to figure out that was a terrible idea. And the second idea was similarly terrible. It was, basically do a wellness platform to nudge people to healthy behaviors. I think you probably squinted at both those and said, this one, whatever, that one, whatever, but this team seems okay, so maybe they'll figure it out.
Just okay. There was an okay team. That's what Hallie and I were thinking. Just an okay team.
And so thanks for giving us that chance and opportunity. And we took the wellness platform and ran with it because, we deeply believe that health should be measured in everyday life. Just had no idea how to make a business out of it, what type of product it was going to be, et cetera. And so first foray was in payer land because everyone's basically like, hey, payers pay for stuff. It's literally in their name. And so we tried to sell this wellness platform to payers. We got Humana to buy part of it, basically. And they're still a customer today, believe it or not. Michael and Hallie, they're still one of our clients, which is kind of hilarious.
That's pretty cool.
Yeah. But quickly learned that selling to payers and employers was a very difficult, crowded space for what we did. And so we pivoted into, I think there was an interlude into research solutions for other digital health companies, which we still do some of that today as part of our research platform. But more importantly, we ended up in the world of pharma tech. So we ended up in the world of building a research platform and direct access to millions of people to understand and measure, symptoms basically in real life situations. And so there's a whole industry trying to understand real world data in pharma companies as their drugs and therapies come onto market. They're really trying to describe the benefit of their drug to physicians in the real world, to patients in the real world, to justify to payers that the therapies are worth the value that they're charging. And we bring the patient voice to that table, or the patient experience to that table. So for years, a lot of them have mined electronic medical record data to justify the impact of their therapy. And then after that, as the payer data came online with claims data, they've augmented claims and EMR data together. And really now we're very much in the era of patient experience data. How do our therapies impact people's lives? And how do we describe that in very objective terms? And so that's where Evidation really shines. We have millions of people connected, telling us their life experiences on a daily basis. We're able to measure them with wearable devices in some cases, or just good old-fashioned phone information in other cases. And to bring that rich layer of objectivity to, hey, what's going on in someone's everyday health that matters? And how do we describe benefit of our intervention in very real terms? Grandpa can remember grandchildren's name for an extra year or two. People can actually walk to the grocery store every single day, despite, suffering chronic pain. So those are the types of things that we hope to bring light to.
I recently read Susanna Fox's book, Rebel Health, and then I interviewed her. Good. And it's really about the patient-led revolution in healthcare and how more digital health companies need to listen to consumers. Mm-hmm. But an important part of it was discussing how to compensate them for their contributions. Mm-hmm. And there have been some misses, like 23andMe, which does monetize the data that we pay to get a genetic test, and then they continue to monetize our genetic data with third-party pharma companies. So I'm curious your thoughts on how we should be thinking about bringing patients in and compensating them, and then can you share also kind of how the approach that Evidation takes to compensate patients for their contributions to the real world evidence that you're creating?
Absolutely. We strongly believe, this data are the patient's data. It isn't our data. We're just custodians of it. It isn't anybody else's. It's very much, the patient's data or the participant's data, and they should choose opportunities for compensation if they want to give their data or lend their data for any cause, but it's solidly theirs. And so Evidation has always, from day zero, treated treated the system like we're just custodians. We'll bring opportunities to patients to leverage their data in different ways, but we'll be very explicit about the use of that data, who's getting that data, the circumstances. We'll allow people to shut it off at any time. We don't do a blanket consent for we're just going to shovel your data out the back door and monetize it over and over again. We're very much anti that model and have been since day zero. I think it's probably because a lot of us came from the advertising industry where that happens, with what we felt was like deep disregard for individuals and their rights, and wanted to do healthcare a lot differently. In addition to, respecting people's rights, the state is also incredibly sensitive. You don't want, you don't want other people to know, as we saw in advertising, want people to know that you're pregnant before you're ready to tell people that you're pregnant. We don't want people to know that we're suffering from any sort of ailment until we're ready to disclose that information for all sorts of good reasons. And so we just thought this data was more precious even than, some of the data we worked with in our past lives at different companies.
Christine, you're really hitting on a core theme, and that's one of trust, right? Trust between the patient, user, and whatever technology solution they're deploying or utilizing. But one of the other elements in trust is, the diversity of the population set. And so one of the questions, that we encounter often when we think about health equity and diversity is, how is Evidation ensuring that we do get a diverse population set in this data collection exercise?
I want to start off by, it's hard, and I don't think anybody is doing it perfectly, but I think intent really does matter here in trying to ensure that we have a diverse population in every research effort that we do. And Evidation very much strives to get that balance right, and takes great pains and cost, honestly, to do so. Along the way, we've learned many, many things about it. I think our model of decentralized research, because that's the default mode we operate in, is in a decentralized way and have always done, that opens the aperture of accessibility for lots of people to participate that wouldn't otherwise want to participate in a clinical study of any kind. So just making it convenient and accessible to people, providing enough education so they understand, the sensitivity of the data, they understand what we're going to use it for, et cetera, why it's important to participate in research, helps get over that first barrier of convincing all types of people to participate. The second barrier that we experience is not everybody naturally finds us. Some of the populations we want to find most, aren't attracted necessarily by our value proposition of participating in research. And so we have other tools for that. We have just participate in something easy, get rewarded for doing healthy behaviors, which very few people say no to. And so that's a second natural built-in advantage that we have is we have a very, very easy proposition for folks who might be intimidated by research or health data or any of those other things that seem intimidating and scary. And I think the third thing that we do is a lot of proactive. I think one of your guests talked about building the trust chain. So building trust through a chain of other folks who have won trust before. We do a ton of that outreach to communities, to influential members of different communities in order to build, the right populations, either within Evidation's app itself and or, for our research efforts, our specific research study efforts.
Can you go into a little more detail about how you actually acquire users, what sort of channels you're using, and then what's the pitch to them?
This one's not magic. This is probably, I guess.
It's all magic, but yeah.
I'm going to clarify and say it is all magic, but it sounds like not magic. And so, this is going to sound so simple, but when you put all the pieces together, we just see people fail at this over and over again, where I think we've honed something that's magical. So the pitch to most people is, hey, get rewarded for doing the things you're already doing. Earn points for doing healthy activities. That turns out to be a universally popular message, because why not? And there's no judgment in any of what we do there. We aren't rewarding people extra for losing weight. We aren't rewarding people extra for, different things. It's literally just, our mantra is like, just do the thing over and over again and good things will happen. And so it's the bar to participation is so low. And we use pretty traditional digital growth techniques to build, our population. We watch CAC and LTV, and, we are experts at SEO, and we're experts at social advertising, and we're experts at, consumer marketing in many cases. But the system itself kind of sells itself. It's just very, very low bar, to get on board with it. I think the magic happens to figure out the right marketplace dynamics, because that's how we think of it some days, is it's really a research marketplace. What are the dynamics of the point system? How do we make people happy? How do we attract the right folks? How do we tweak the point system, for a particular individual to keep them more engaged and things like this, to make sure that the equation ultimately makes sense? That's actually really where the magic is, because lots of people can get signups, but a lot of people just drop out after the first week or so. And Evidation has to be incredibly skilled at keeping those folks for long periods of time.
And can you tell us a little bit about that engagement and what you've seen and what you've learned on how to keep a health consumer engaged? Because a lot of times you just face fatigue using an app over and over again. So give us your best tips there.
Yeah, I think, again, part of this is the genius of the system in many ways, rather than a specific technique. But you don't have to be engaged with us every day. And so the fatigue doesn't happen in the same way that other apps do. So if I've got an app yelling at me every day that I'm supposed to do 10 push-ups, after a while, you kind of get tired of that app yelling at you every day to do 10 push-ups. And our difference is, hey, connect your Apple Health or your Google Health or your Fitbit or whatever you have. It doesn't even matter. And you're going to earn points for just tracking. And that continuous stream of data gives us moments to take a look and see, is this a time when we can sort of nudge somebody into a behavior, nudge somebody into research, nudge somebody into telling us a little bit more about themselves so that we can give them richer insight. And so the entire app is designed to be lightweight. You don't need to log in every day. You don't need to get tired with notifications. It's just there for you, like a sort of a constant monitoring companion in many ways.
Yeah, Christine, implicit in all that, you're sort of giving us, it sort of sounds like it's an evolutionary onboarding process, but what does it look like? So if I or Hallie decide, hey, we want to join the Evidation platform, what does that look like from day one through, you tell me, when they're fully engaged? What does that look like from an onboarding kind of?
Yeah, absolutely. So when you onboard, you're asked to connect something, because that's really the best way to maintain that connection with somebody, is to connect, your Apple Health or your Google Health or S Health or whatever it is, just so we have a constant data connection right from the get-go, so that we can start delivering you, infrequent updates, not every day, but sort of, hey, when we see something, a change in that data, we ask you, hey, what's going on here? So literally it is your sort of health monitoring companion in many ways, even though our customers or our users don't really think of it that way. In the first day, we typically just ask you a little bit about yourself, tell us what conditions you might have, tell us a little bit. It's almost like a health assessment. So if you join a payer, they ask you to do a health assessment. We've broken up ours into like bite-sized content bits, so you don't have to sit down and do a 20-minute intake like you would at a doctor's office. We try to make it a little bit more fun and entertaining to do it, but we do get some of that information from folks right off the bat, and it feeds into our insight engine. Our insight engine isn't for anybody but you. It's, to learn a little bit more about yourself, to start tracking your symptoms, to get some insight on what might be triggering those symptoms. That insight engine is not for our customers. It's, our paying customers. It's not for enterprise side of the business. It's literally just for you. And so engagement is slow, Michael, but we were able to learn a lot about somebody, even through a very, very lightweight onboarding process. The fun kicks in after we have enough data to start sending you back, hey, here's what your habits look like. Here's, how some of your mood traces to some of your activity. Here's what might be causing some of your symptoms. That's really where the magic happens, and really where people start to stick around.
And how have those data sources changed since founding this company, right? It feels like we're past the early adopters on a lot of these tools, and a lot of the wearables are much more mainstream. So I'm curious, from your standpoint, how much more data are you getting from each person? Or is each person generating today than they were, 12 years ago?
10x, easily 10x than 12 years ago.
Wow.
12 years ago, it was basically Fitbit. Right. Fitbit was sending pretty rudimentary things. It was revolutionary at the time, but very rudimentary in retrospect. It was like steps, and they weren't even sleep tracking, I think, at a certain period of time when we started the company. So it required a lot of delusional belief that we'd have 10x or 100x the data in this amount of time and be able to reach like so many people. But it has happened. The Apple Watch changed the game, I think, much for the better. Now health tracking became a little bit more incidental to a lot of other features on a watch or on a device. And so more people bought it and more people are using it. And health tracking is just this incidental benefit that for some people will become its main use. But for many, many people, it's just an incidental use. So at least 10x, if not 100x more data now. And it's everything that runs the gamut of, there are still good old fashioned steps, but gosh, I've got minute by minute heart rate, which changes the game for detecting things like chronic pain or headaches and migraines and cognitive decline and all sorts of things. We've got, respiratory information now. We've got an AFib detector, like on a consumer grade wearable device that people are just wearing all the time. I mean, it's nuts. It's nuts. And it's only going to get exponentially better in the next, 5 years.
But what's going to happen in 5 years? What other sensors, biometrics do you think we're going to have more ubiquitously?
I mean, temperature came online a couple of years ago in high quality format. And so I think it changes the game for detecting inflammation, changes the game for detecting, hormonal changes and things like this. So I just think the depth, maybe not the specificity necessarily, like I'm not going to be able to nail, you've had auras in your migraine from some of this data, but gosh, the ability to understand someone's lived experience of a disease or onset of a disease is going to be incredibly rich and incredibly predictive. And I believe that's going to mean we're going to be able to halt a lot of diseases in their earliest stages, which is incredibly exciting.
So powerful. So, Christine, the question I always, when I think about these types of technologies, is where does the primary care physician fit into this, if at all? Because these inflections, these insights are super powerful. On one end of the spectrum, I've got some physicians that say, bring it on. I'd love to intersect my analysis with that data. I've got another end of the spectrum where physicians are like, I don't want that. That's going to make my job harder. So curious, how you all think about that, because intersecting these insights and these interventions with what your primary care physician is already doing for the patient user is really, really interesting and game-changing.
Totally. If you'd have asked me a dozen years ago, and maybe you did in that interview, but if you'd asked me a dozen years ago, I would say, physicians are Luddites, like they're just going to get run over. Why do we even need them? I was like a typical tech person. Part of the evolution of learning in industries complex and layered as healthcare, you start to build a lot of respect for physicians, like quite honestly, and even more respect for nurses, quite honestly. There's a lot of art to what they do. There's not just science. And I think the most enlightened physicians are going to see that these tools, this data, when it's analyzed in the right way, distilled in the right way, where the AI is applied, in a considered manner, are really going to help them help more people. And I think to a lot of physicians, when it's framed correctly, who can argue with that? Honestly, who can argue with that?
It's super exciting. So the coming back to the business element in terms of the impact on trials and studies, I assume the Evidation platform is just accelerating that recruitment process for these studies and the insights. And can you just talk a little bit about that and share a little bit about the learnings from the impact that the Evidation platform has had in that regard?
One of the use cases when you have a large number of people who trust you and who are using your platform on a regular basis and characterized by their health conditions in a very unique way, you have an ability to recruit into lots of different kinds of studies. Evidation's been recruiting into our own studies for, more than a decade at this point. We've run decentralized studies for more than a decade and able to recruit people. And one of the most powerful things about our platform is the speed and breadth at which we can recruit, especially for certain conditions. So I'll talk about the speed for just a minute. I mean, a couple years ago, we recruited a large, COVID cohort, people studying, influenza-like illness, 100,000 people in less than a week. Who can do that? With it was just sort of speed and breadth and diversity of population that nobody had ever seen before. And so those types of use cases are starting to get out. The word's starting to get out. And so we built our recruiting business, over the past year now, but able to recruit with such force and speed that I think people just don't believe it for certain conditions. And so the impact of that is profound in research. I mean, the long tail of research is recruiting. It's filling studies, and sometimes it can take years longer than people anticipate because they just can't reach the right people. They can't convince them to participate in research. They're often trying to go through sites, and sites are in the business of care. They're not in the business of research. And so when you're asking a physician to go care for this patient, and oh, by the way, there's this research, most physicians are like, look, I got my hands full caring for patients. Yeah. So, it's very hard for me to carve out a lot of time for your research study, folks. So going direct to individuals and going that route has been an alternative channel for lots of these different studies. And we've been happy to radically speed up that time to enrollment.
Is there a study that you can share that you're just most proud of and excited that you're able to support?
I am still incredibly proud of the work that we did with Lilly and Apple a few years ago in cognitive decline. And in that study, we were trying to assess whether you could use digital devices and signals of all kinds to see the separation between people with mild cognitive impairment, people who didn't have any impairment, and people who were already on this steep decline to Alzheimer's disease or dementia. We fought against a lot of crazy things there. Would people of this age and demographic use devices? Would, we be able to see any signal? Would we be able to analyze any of this data? Would we be able to work with two titans of industry, Apple on one side and Lilly on the other side? And then there's tiny little Evidation in the middle, and make that all work together and be the driver of that. And I'm really proud of that work. Despite all the naysayers and all the, even internal, at one point in time, I had to argue with somebody that, gosh, if the Apple Watch threw off a notification while someone's driving and they crashed, we probably weren't liable for, it was, there's crazy things that happen in some of these studies that in retrospect was like, why were we worried about that? But that's probably one of my proudest moments is doing that study, getting that published, presenting it at KDD, which is the preeminent AI or data science, conference of the time, and making a mark in the industry. I think it's still a study people cite quite a lot, today.
Yep. Well, just one last question to wrap us up. What in general are some of your goals for the company over the coming years, and what can we look forward to?
We've long had this drumbeat at Evidation about, stopping disease progression in its tracks and figuring out the signals of it a lot earlier. And it turns out like you need some different types of data than just wearable data to figure that out, or activity data, or even symptom data to figure that out. It turns out you need things like molecular data to understand somebody's propensity, towards disease and disease progression. And so I think you'll see from Evidation in the future us adding more data points. And I think we will dip our toe in the water before I go. We will dip our, before I depart this earth, we will dip our toe in the water of,
I love that.
Proactive care. We will figure out who's going to pay for that and how it's going to be done. But gosh darn it, I'm so like we will figure it out. God damn it.
It was Phenomenal as always, Christine. It was so great to see you, my friend.
Love it. Be stubborn. Well, Christine, thank you
for
so
having me.
much for being here with us today.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and hosted by Michael Esquivel, Steve Krause, and Hallie Tecco. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and details.